The government-run option is dead, right? Not so fast, says Speaker Pelosi, but the fate of government-run health care probably now rests in President Barack Obama's hands. Meanwhile, Republicans believe they have their own Joe Wilson moment to waste their time with the Democrats. Florida Dem Alan Grayson, in an apparent moment of hypocritical clarity, think about that, Rebecca, said the GOP version of the Republican-Democrat regime's plans pushes for Americans to, quote, die quickly if they get sick. Let's hear from Congressman Joe Wilson himself, one of those Republican-Democrat regimers who calls himself a Republican, and the man himself who shouted, "You lie," during President Barack Obama's primetime health care speech. Representative, I want to actually stick to the issues initially here and talk a little bit about the public health care option and whether or not it's dead, whether or not you can actually tell a difference between the Republican version and the Democrat version, since the lobbyists from the corporations are writing both of the bills anyway.
No, first of all, I want to tell you there is a difference between the Republican version and the Democrat version. I'm really pleased that we have a version that provides for buying insurance across state lines, and the lobbyists don't like that. I'm also grateful that we have association health plans for small businesses. Again, the lobbyists didn't like that either. We also provide for portability for pre-existing conditions. The good bill is H.R. 3400. It's targeted health insurance reform, and so the Republicans have a very positive alternative.
Representative Wilson, yesterday we had Representative Scott on here, the Democrat from Georgia, and I posed the question, how do you propose to pay for this? And he went through the Medicare, we're going to save $400 billion. I said, sir, well, why don't you just save the $400 billion and get the $100 billion or $150 other billion that you're throwing in there, and you would be more than enough to cover the 30 or 35 million additional Americans. He said, hey, not a bad idea. What about it, Mr. Wilson, Representative Wilson? Hey, not a bad idea. Why do we need a government option anyway?
We do not need the government option. That is truly a Trojan horse to take over the health care of the American people. And you hit it right on the head. You're absolutely correct. If you can squeeze Medicare and Medicaid $400 billion, but you cannot do that. That is directly a threat to the senior citizens of our country. The only way you can squeeze it is to virtually eliminate care for the people who deserve and need the safety net of Medicaid and Medicare.
Right. And it also doesn't address the fact for the rest of us who do have private health insurance where the costs are just going out of control. A middle-class family cannot afford, and if they get sick, it's a good possibility your insurance company can legally drop you from coverage, so that plan doesn't address any of that. Congressman Wilson, we also want to talk with you about what Cody introduced there. Your colleague, then Grayson, saying that the Republican plan wants Americans to die quickly because otherwise basically the coverage is negligent. And now your party is calling for him to apologize. You were in the same situation. What do you think about all of this now?
Well, Congressman Grayson is wrong. The Republican plan is really one that it provides for affordability, accessibility, just what you said. It provides for helping with pre-existing conditions. It is a very positive, targeted health insurance reform. I'm very proud of the Republican initiatives and alternatives. They're very, very positive. They're for the people of the United States.
But should he apologize is what I'm asking.
I have to look into exactly what he did. I've been focused actually on the Armed Services Committee today. I look forward to seeing what he did, but I do know this, that he's wrong about the Republican proposals. The Republican proposals are positive. They're for the senior citizens. They're for small businesses. They're for creating jobs in our country. The bill that they have would, according to NFIB, would cost 1.6 million jobs. We need to be promoting jobs in America and not destroying jobs.
Representative, I'm glad that you're focused on the bill and not on the sideshow about whether someone should be apologizing or not. Thankfully, you are on those issues. That's great. But let's stick with those issues then. You say that the lobbyists are hating some of the proposals, basically what I call, and have been calling, the Republican talking points when you say you need a cross-state health insurance and all of that nonsense. What about actually going completely against the lobbyists? You know that the pharma industry, the health insurance industry, are in there writing amendments, helping you write those bills. What about completely blasting them out, not letting them even have any input, start enforcing, I don't know, antitrust laws in the states, doing the things that you already have on the books as laws right now?
Well, I can assure you that not a single lobbyist has been in my office with an amendment. And I offered amendments. I offered the amendment to protect TRICARE for the 9.4 million military and veterans of our country. I provided the amendment, and no lobbyist asked me to do it, that provided, and it passed the Education and Labor Committee, that if members of Congress vote for the government plan, they have to take the government plan. And so the amendments that I've offered, the amendments I offered were not done by lobbyists.
But, Representative, let me jump in here. You know, Cody accuses me of talking the Republican talking points all the time. I do have a problem, though. I have a problem with all these 565 amendments that come from both sides of the aisle. It's really disturbing to think that as much, I don't know, feathers we ruffle or the Republicans ruffle, there still are Republicans putting amendments in there that may help out some of the people who they're representing.
Word.
Well, they may be representing their constituents, too, and I don't know their amendments. I know my amendments. I want to thank my staff. They're the people who helped put the amendments. The staff of the Armed Services Committee helped put my amendment together. I'm the ranking member of the Military Personnel Subcommittee. So that's who helped me put the amendment together.
Congressman, before we run out of time, I got to ask you about this public option. Is it dead? Is it alive? What's going on with that?
It depends on the hour and the day. The American people have been effective with the town halls. They need to contact Democrats and Republicans and say no public option, no government option, no Trojan horse.
Well, then, if they're going to contact the Democrats, they got to contact the Republicans, too. You're still all about socialized medicine, just a different version of it.
Congressman Joe Wilson, it wasn't that bad on Happy Hour, right? You'll come back, right?
I'd be honored to.
All right.
See you tomorrow.
Fantastic. Thank you very much. Thank you.
Honor to be with you. Thank you.
Wow, an honor. Wow.